Thank you everybody for joining the Larimer County COVID-19 community update. We'll get started in just a minute. All right. Thank you everybody for joining us for this 1-hour session with experts from our community to provide an update on COVID-19 in the community. My name is Corey Wilford. I'll be moderating this call and asking questions as they come in from our community toward the end of the call. Tonight on our update is Public Health Director Tom Gonzalez, Kevin Unger, the President and CEO of UC Health, Northern Colorado Region, Margot Karsten, Western Region President at Banner Health, Chris Urbina, Medical Director at the Larimer County Health Department, and Jared Olson, the Population Epidemiologist at the Larimer County Health Department. I will turn it over to Public Health Director Tom Gonzalez.
Thank you, Corey, and good afternoon. And thank you, everyone, for taking the time to attend this important update on the pandemic in Larimer County. I will be providing an update on the major metrics we are tracking, which is case rate, percent positivity, and hospitalizations. Dr. Chris Urbina will give a brief update on some good news regarding COVID-19 vaccine development. And Katie O'Donnell will provide an update on our Prevention Starts at Home campaign, and then we'll turn it over to our hospitals. Next slide, please. Looking at the first metric, the rate at which cases are increasing is one of the highest in the pandemic. There are some more cases and more community transmission than at any other point in the pandemic, including during the April stay-at-home period. When we look at the graph here, we're looking at our 14-day case rate. You've heard that quite a bit in the last few months, but with some trending issues that are very concerning. During September 14th to October 1st, we saw that case rate double in 18 days. During the month of October, it doubled in 31 days. And recently, in astounding 13 days, it doubled, and it continues to increase. This is the fastest rate of case increase at any point in the pandemic, with no signs of slowing down. Next slide, please. When we look at our cases per age, we're seeing an increase in all age groups, with the greatest increases among adults 18 to 60 years of age. The percent of gatherings held outdoors is declining, and more cases are reporting gathering indoors. We know that the respiratory droplets, the vehicle that carries the SARS-2 virus, is easily spread indoors at an astounding 18 times more rate than indoors. So this transition started in October of people going indoors for gathering, with more than 50% of gatherings exclusively indoors. Now, early November, we're seeing 75% of gatherings indoors. Evidence of transmission between households through social events and gatherings and through the workplace. Recently reported large gatherings attended by positive individuals, including weddings, youth sports, church services and events, restaurants, get-togethers at bars, and birthday parties. The significant increase in cases is making it extremely difficult to contact trace. And nearly 50% of our contact tracing is coming back as community transmission, where the positive person doesn't know where they were exposed. They weren't around someone that they know had symptoms or tested positive for COVID-19. That is up from 26% of cases were community transmission in July, or almost doubling in November. Next slide, please. We're going to talk a little bit about the stay-at-home index in Larimer County. The stay-at-home index uses cell phone data to estimate what percentage of the day county residents are staying at home. The stay-at-home index uses the amount of time people spent outside the house in January and February 2020, before the pandemic, as the baseline comparison to current activity. The closer the stay-at-home index is to 1, the more residents are staying at home. For example, if the median time spent outside the house was 10 hours before COVID, and now the median time was only 1 hour outside the house, then the stay-at-home index would be 0.9. If the median time outside the house was cut in half, it would be 0.5. After Colorado's stay-at-home order expired at the end of April, the index remained above or near 0.5 for 2 months. In the last 2 months, only the most recent week has been above 0.4, with most weeks closer to 0.3. Larimer residents spent more time at home in May and June, helping us reduce the transmission of COVID-19. Now we have weather conditions and indoor gatherings that increase the risk of transmission indoors. And when you look at the graph, we've had a couple little spikes, and those were related to snowstorms. Now, what we really need to curb the tide on cases is we need to get to that 0.75, where people are staying more home and they're not gathering with multifamilies. I know this is difficult, but as we talk about our hospitalizations and the concern there, it's everyone's obligation to stay home as much as possible. Our goal is to get to 0.75. According to our data, if we got to that rate, we could start drastically reducing the cases, the transmission, and reduce our hospitalizations. Next slide, please. It's a pretty busy slide here, but I'm going to touch on the hospitalizations briefly, and I'll let Kevin and Margot get into more depth of what they're seeing in their hospitals. But on November 2nd, Larimer County hospitals were treating only 8 people with COVID-19, whereas today we have 88, that just went up, people being treated in our hospitals. We have seen a significant increase in hospitalizations in the last 10 days, and the numbers keep rising, very concerning. Hospitalizations usually lag about 14 days after cases are identified. Over on the right here, that's the Colorado dial. And looking at the 3 metrics in the Colorado dial, the first metric is that 2-week incident rate, where we're hovering at 792 per 100,000. The percent positivity has climbed, unfortunately, over 10% at 12%, and our hospitalizations is now in the red due to the increase in COVID admissions to our hospitals. Based on our current incident rate, if we have 10 people at a dining table, there is at least a 75% chance one person is positive with COVID-19. Again, this virus affects people very differently. Some asymptomatic, they don't show symptoms. Some, it puts them in the hospital, and some it becomes deathly. So you think about that. If you're at a table and you're there with multifamilies and you have 10 or more, the chance of someone being positive there is fairly significant. And that person may be what they call a silent transmitter. They're asymptomatic and they don't know they're spreading it through the respiratory droplets. Next slide, please. Now, we're not the only county dealing with this. Just about every county is dealing with it, and every state in the union is dealing with it. This is from the Colorado dial. You'll see just about every county has case rates of greater than 350 per 100,000. It's just pointing out that we're not the only one dealing with this big surge or the third wave. Next slide. Next slide, I will turn it over to Dr. Chris Urbina, our medical officer.
Thank you, Tom. This is some good news, and can you hear me okay?
Yes, sir.
Okay. This is some good news, and I want to put this in context because all of the things that you've talked about so far in terms of our prevention strategies, wearing a face covering, physical distancing, not gathering in large groups, washing your hands, are still important, even though there's hope on the way with the COVID vaccine. So let me just talk briefly about how we think currently the federal government is going to be rolling this vaccine out. Many of you have seen in the news both the Pfizer and the Moderna vaccines have shown effectiveness above 90%. That's encouraging news. We do know that they're still in clinical trials. so that they haven't been approved yet by the FDA, that's the Federal Drug Administration, for emergency use authorization or utilization. We anticipate that that'll happen over the next month or two, and that this rollout will occur in phases. Phase one rollout, and hopefully our hospitals will know a little bit more about this because they're going to be the first target. Our healthcare workers, and that's what HCW stands for. Our inpatient healthcare workers and our outpatient healthcare workers will be prioritized first because they're first in line to actually continue to treat the large number of COVID-19 patients we have in those healthcare settings. Our second phase of that second part of this first phase is for first responders, people that are emergency workers, public health workers who are on the front line. And the third part of that phase one rollout are those people that Tom alluded to earlier, those people in long-term care facilities, that's what LTFC stands for, and assisted living. And those are the ones we know that are very vulnerable to the virus. That is, if they get the virus, they have greater numbers of complications and could be hospitalized. And I know both of the chief executive officers will talk a little bit about who's in our hospital a little bit later. Our second phase, phase one rollout will probably occur, hopefully, between now and the end of December. Phase two rollout is going to be targeted folks who are people living with homelessness, people in jails, people who don't have the abilities to get access to services, and higher risk individuals, those folks over the age of 65, people with chronic medical conditions like diabetes, lung disease, heart disease. That's going to be the second phase of this rollout. This is what we think. That will likely occur in the winter, spring of next year. Phase three rollout will be for the general public, and hopefully we'll have not only the Pfizer and Moderna vaccines, but we'll also have other vaccines that are currently in clinical trials being waited or waiting to be approved, as well as to make sure they're both safe and effective in reducing the amount of infection. Hopefully that'll be in the spring or summer. We will likely be receiving the Pfizer ultra cold storage vaccine. The challenge with it is it has to be kept super cold in these very super cold refrigerators. I think they're greater than minus 75 degrees centigrade. It will likely be a 2-dose vaccine with at least 21 days apart. So you'll be hearing more about this as we roll this out. We'll be working closely with our hospitals because they'll be probably the first folks to receive this vaccine. And then we'll be working with our general populations, including our primary care providers, and rolling this out to the next phase. So you'll hear more about this. This is good news, but it should not discourage you. You should still continue to do the prevention strategies that we're going to highlight today. Thanks, Tom, for allowing me to present this.
Thank you, Dr. Urbina. Next slide. And I'd like to turn it over to our Office of Communications Manager, Katie O'Donnell.
Hey, everyone. So obviously you're hearing about a big shift in messaging out in the community to really minimizing our in-person gatherings. This is a big deal as we head into holiday season. So this is the new Prevention Starts at Home campaign rolling out of our office. You will hear it shared on radio, digital advertising, social media. There's a good amount of other outreach. And then a lot of our partners will be sharing this messaging and media as well. Really, the idea is that our community taking this seriously and not having these in-person gatherings in home indoors and keeping your groups really small will help keep our community as open as we can and our hospitalizations down, and hopefully our healthcare workers, staff able to be in and serving our community. So this started this week. You'll hear more of it on radio, and it will move on to other mediums here next week and into kind of taking us through the end of the year.
All right, next slide. I'll wrap it up before we turn it over to our hospitals. Our cases, as you saw, are increasing at an astounding rate. We have to reduce the case rate. We are not in compliance with the Colorado dial. We want to balance our economy as well as our public health safety. But when we talk about our hospitalizations and our utilization for care, it becomes very important to all of us that our hospitals have beds and they have healthcare workers there to aid for whatever the emergency is, whether that's an accident, a heart attack, or COVID-19. Our hospitals are filling up with COVID-19 patients at an astounding rate as well, as we've demonstrated. So with that, I'll turn it over to Kevin and Margot to give their presentations on what they're seeing in their hospitals in Larimer County, as well as in Greeley.
We'll go ahead and have Margot begin.
Okay.
I think Jared has her slides. Thank you, Tom. Thank you, Dr. Urbina. Go ahead, Margot.
Thank you. I always start our meetings together that I just want to commend the staff at the health department. Tom, you and your team have done a nice job, as you said, balancing public health with a healthy economy, and it's not easy, and it's going to take all of us. So with that, I'll walk you through some trends that we're seeing, and then I'll hand it off to Kevin. I'm hoping. Or not.
Your slides, Margo?
Huh?
Can you see your slides? They're presented.
I can, but I think someone was going to move them for me.
Oh, I've got them for you.
Okay, you can go ahead. Sorry, Jerry.
Okay. Yep.
So I like to take a broad look. Kevin and I have talked a lot together, UCH and Banner, and what we're seeing the second time is different. The first time through, Colorado went first on the surge. What I like to keep in front of us is our neighboring states, because it does make a difference. We know people go back and forth, and the higher the rate, the more prevalent the disease. So I like these indicators in that it tells me how fast the virus is spreading and where. It also, if you look to the right, how many days to double, which is alarming. We're all in similar situations, and what that is, what's happening then is it's compressing our bed availability in all 3 states. Next slide. This is an interesting rate. Some people ask me, what sites do you watch? If you Google reproductive rate or the R naught for COVID, this moves every day. And basically what we want to do is get Colorado green. If we can get under 1, that means that how fast the virus is spreading is slowing down. Again, you can see our neighboring states. Wyoming is leading, and then Nebraska, and then Colorado at 1.1. Our goal is to get it to the green where Mississippi is. And again, this just tells you how fast, not how concentrated the virus is, but how fast it's spreading. So we are in a fast growth spread of this virus. Next slide. This is echoing what Tom had shared. When I think about why the hospital teams are feeling stressed, you can see the exponential growth that we're experiencing of the new cases per 100,000. The green line is Colorado, and then our neighboring states, Nebraska is in blue, Arizona purple, and then you can see Nebraska, and then Wyoming is on the bottom. But you can see the steep incline, and you can see that that's why it's so important that we work on this together and we bring these trends down. Next slide. This, very similar to what Tom showed, when we were in April together, UCH and Banner, we held the community safe. What we're seeing, if you go way to the right, we are surpassing the April volume. I'm getting a lot of questions on how long is this going to last. To Tom's point, when our positivity rate in the community is high, which it is, it's going to take easy 2 to 3 weeks for both UCH and Banner to notice a decline in our inpatient admission rate. So at the minimum, we're in this for at least a month, if not 2 months. And that's why it's so important that we partner together and we stay safe together. Next slide. Again, similar, these are inpatients. It just really follows that curve that you saw before. We're nearing where we were in April from our peer COVID inpatient numbers. Next slide. 28% increase for Banner from our COVID admissions from yesterday to today. Length of stay for our COVID patients are ranging around 7 to 9. I always pause because sometimes we'll get questions, but they're not as sick this time. They don't use ICU. Last time we had about 2/3 of our patients being tucked into ICU with a ventilator. This time it's 1/3, but still the patients that are inpatient are very sick. We have an acuity measure called case mix index. It's how sick are our patients when they're in bed. 2.0 is very sick. Right now it's about a 1.8. So you can tell on a measure of acuity, very sick patients in our facilities. Again, what's different this time is because the positivity rate, both in Weld and Larimer County, is high, so about 10%, our staff are now getting sick. And so that's been a dramatic difference than what we experienced in April, because people were at home and staying within their immediate kind of family bubble. We did not see our employees get sick while working. We are now. And I believe it's what I see. My daughter's 17, and even though I tell her all the time, keep that mask on, we just both got tested early this week because she was exposed with a friend. They were having coffee and she didn't have her mask on. And so it's these small gatherings with people that you think are in your bubble, but they're not. It needs to be your immediate family, masks on all the time, social distancing. And if we don't do that, our care team is getting sick. So what can we do as a community? Wear our masks. There's good research. If you're interested in articles, we can send them. They're evidence-based that wearing masks will decrease easy 2 to 3 points every time we wear them in our community. Wear it appropriately, over your nose, over your mouth. Wash our hands, wash your masks daily. K95, sometimes I'll get asked, does it matter what kind? I'm encouraging K95s versus fashionable masks. That's what I tell my daughter. Ditch cute and go practical right now. Social distance means stay with your family, but whoever's living in your home would be my definition of an immediate family. And then, like I said, hand hygiene. And I think, Tom, I'll just end before I hand it off to Kevin. I've been here 25 years in this community. Why I'm hopeful is when we lock arms together, healthcare systems with our community, we can lower this trend because we've been through floods together, fires together, and COVID together. And I know that when we work together, and I love Katie's message, what can we do? Stay together and stay in your immediate family, put our masks on. We can get through this and keep our economy open, but it's going to take intentional effort and not make it political, make it about public health and caring about one another. So Tom, it's just been probably the only blessing in COVID is the amount of work and time that we get to spend together. And I really am impressed with your team. And I would not have known you this well without COVID. So I try to look for the blessing in all of this, and you all have done great work together. And we can do this one more time. Kevin?
Thanks, Margot. And great presentation, Margot. You did a nice job kind of summing things up that are occurring here in the community. Katie, do you have my video that you can run before I start?
Yep, are you ready?
I am. Thank you, Katie.
Mm-hmm. See if I can get it.
It is exhausting, but it is also exhilarating. But this is exactly what we train for. We've got a job to do, and we're the people to do it.
I I will say I've never seen more teamwork, more support of each other than I have right now. It is nothing but trying to figure out how do we get through this together.
We care so much. I'm going to be an advocate for a patient today, and I'm going to try and put a human touch on this whole situation.
Patients that are vented can still respond and follow commands, and they get teary-eyed when they hear family. There are some families that say, can I call at the same time every day? And the answer is yes. Find hope in the fact that we are seeing patients go home, because we know that for every discharge here, there's another discharge somewhere else. And if patients are going home to recover, then there's hope that we can get through this.
Appreciate that. Thanks, Katie. That video really kind of sums up what's occurring right now. My name is Kevin Unger. I'm the president and CEO of the Northern Region for UC Health, and I'm blessed. Margot hired me many moons ago, and we've worked together for quite some time. And what I must say is that it is gratifying to see the systems working together the way that we are. We're on calls daily, just trying to kind of navigate this new world of COVID and figuring out where we have bed capacity. And it's been a pleasure, and just thanks for your partnership, Margot. Do appreciate that. When I'm out and about, or when I was out and about, before everything really got locked down, I was getting asked 3 primary questions, and I'll just kick it off with what those questions are. The first is COVID real? And I think we've all come to the realization that it is, and that video kind of exemplifies the fact that we are taking care of COVID patients on a daily basis. The second question that I get is, does masking help? And it certainly does. We need to continue the habit of wearing masks. I often, if I'm on a phone call when I'm heading into my office, I sometimes forget, and I get halfway in and remember it needs to become more of kind of just the way we do things. And so masking is important, not only for ourselves. It is proven to help us, but more importantly, others, and it helps decrease the spread. And then the third question I get is, how are the hospitals doing? What are our volumes? And so as we sit today at Medical Center of the Rockies, we have 39 COVID positive patients, of which 9 are in the intensive care unit. At Poudre Valley, we have 38, 11 in the intensive care units. And then in our Greeley facility, our brand new Greeley hospital, we have 19 patients that are COVID positive, with 7 in the intensive care unit. So that's 96 patients that are in-house. Last week at this time, so I went back exactly 7 days, we had 64 patients in-house and 20 in the intensive care unit. And if I go back 3 weeks, we had 30 patients in Northern Colorado that were COVID positive. So we are seeing extremely quick increase in our volumes. And things are different this go round. Margot mentioned kind of some of the changes, kind of the first surge, or the first and second surge, depending on kind of how you characterize it. Some of our biggest issues within the facilities was supplies, PPE, and masks, gowns, gloves, testing supplies. All of those were really in limited supply Today, our biggest issue is really around staffing and keeping our people healthy so that we can take care of our patients. And so the shift has been from more of that supply side to staffing as we move forward. We also are seeing an uptick in testing. And so when all of this started as a state, we were doing about 5,000 tests a day. We're currently doing a little over 20,000 tests a day. And within just the UC Health system, we're continuing to figure out how we can bring new testing modalities online. And we anticipate that as a system, just after Christmas, we should be able to actually run about 9,000 tests a day just within the UC Health system. So we're really improving upon the testing capabilities. The turnaround time is still around 72 hours. 3 days. We are working on trying to bring that down. Truly, our goal is to get that to within a few hours. And we think that will be important. And then just the dramatic increase in our volumes. This surge, we're seeing less individuals that are requiring ventilators. And so the first and second surges, we are seeing about 50% of our patients requiring ventilators. Now that we have ample supply of pharmaceuticals, including remdesivir and some other modalities, we're able to keep patients out of the ICUs at a much better rate, which is terrific. But our medical units are also full. And that leads me to another point as to why this is different. This is always a busy time of year for hospitals, regardless of whether we're dealing with COVID or not. This is just a tough time of the year in terms of sickness and people requiring hospitalization. So we're starting at a different point this go round, and we're seeing a much wider variety of patients within the facilities, not only just COVID patients. The staffing piece is really challenging. And so we are fighting for the same resources that the rest of the nation is. It's really a critical care nursing shortage at this point. And so I was talking to my colleague in Cheyenne, Tim Thornell, and he was talking about bringing in travelers and at about $130 an hour. And I said, that's crazy. How can we afford to be paying those rates? Come to find out, we're closer to about the $150 an hour, and we still can't hire or get critical care nurses here. And so we have to make sure we keep our staff safe. We are working hard at socially distancing our break rooms, our cafeterias, trying to keep people away from each other. And we're all social beings. That's why we were drawn to healthcare to begin with. And so within the hospital, we're able to contain that. But community spread impacts us because, as Tom mentioned a little bit earlier, multifamily gatherings really has the opportunity for community spread, which impacts our overall staffing. We are scaling back on our non-emergent surgical volume. We're canceling a lot of hip and knee cases. So if you're scheduled, just continue to check with your physicians, because most likely they will get pushed out. We still are doing emergent surgeries, of course, and taking care of anybody that needs our services, which leads me to another point, which is if you are feeling, yourself better than anybody else does. And so if you are suffering from heart or chest pain, or you feel like you're having a stroke or anything else, do not hesitate to seek medical care. We are here to take care of you. And we did see the first and second surges that people were hesitant to go to the hospitals, but time is brain, and time is heart, and time is muscle. And so make sure that if you are experiencing any kind of symptoms that you are going to to the hospitals or seeking your primary care docs to talk about what medical needs you do need. Do not delay care. We're also on kind of the staffing front. We've shifted from our thinking. We are going to make sure that, you know, we're feeding our staff while we are in an incident command mode, which we anticipate will be through the end of January. And what incident command mode means is that every admit into our facility, we are figuring out and triaging where that patient's going to get the best care, where we have the physical bed capacity, the resources, and the staffing, and that includes discussions with Banner Health and Margot and the region. We've also been tasked by the state. There's a new executive order that has set up a statewide transfer center, and we basically have adopted rural facilities to make sure that they have their support systems in place as well, so that we can best take care of this state as we move on. We are, as I said, we're going to be feeding our staff breakfast, lunch, and dinner just to try to lift their spirits. I'm seeing, and I am concerned because everybody is tired, myself included. We're all COVID fatigued at this point, including our staff. And so, you know, the first and second phases, we were having a lot of, you know, the chalk art and the flyovers and the first responders doing parades and the 8 o'clock howl. I know my parents are on this call and they're still doing it religiously, and I appreciate that. But if you know a nurse or a first responder or a physician, do your part to make them feel like a true hero, because it's going to take a lot of energy, a lot of different, everybody peaks and valleys at different times. And so if we can get that community support rallying around these first responders and our frontline staff, that's what will carry us through. And so I would appreciate that. On the vaccine front, great news this week. Dr. Urbana discussed that UC Health is part of the Moderna trial, which is proving to be over 90 or close to 95% effective. We are also part of the AstraZeneca, which is also known as the Oxford trial here in Northern Colorado. We have enrolled 700 patients thus far. Our goal is to enroll 1,500. We think we'll hit that halfway mark next week. If you have a desire to be part of the AstraZeneca or the Oxford trial, please go to uchealth.org. You can click on the Loveland vaccine trial and you can do a quick questionnaire and get enrolled in that. We think that it is showing a great deal of promise as well. One area that we really could use some help at right now is convalescent plasma. And so just a week and a half ago, we had about 160 units of convalescent plasma. Today we have 16. And so if you have been exposed to COVID-19, have been symptom-free for 14 days, you are potentially a convalescent plasma donor, and we would really appreciate your help and support, and we would gladly take your plasma. And so if you have any questions or concerns, the Garth Englund Blood Bank here in Northern Colorado is spearheading the convalescent plasma drive, and we would very much appreciate any of your help. And so in closing, what we're seeing is a lot of mental health issues popping up as this pandemic continues to drag on. We're seeing more alcoholism, more drug use, more depression, more loneliness. And so as a community, let's all reach out. Give calls to loved ones, friends, keep checking in, making sure that people are doing all right. I know students are now going to be going strictly online. Keep an eye on our school age students, but also check in with our seniors, and let's make sure that we are banding together and taking care of each other. This is going to be a marathon. I think we're in this for a while now, and so whatever we can do to support each other is going to be incredibly important. And with that, just thank you for all of your support, and happy to answer any questions that you may have.
Thank you, Kevin. We are going to go ahead and take some questions from the community. Let me pull up what we have. So the first question is for Dr. Urbina. Evidence suggests using a PCR test at more than 30 cycles is not indicative of illness or of a virus that can replicate. Do you know how many cycles laboratories testing in Larimer and those being reported in data on the dashboard are using?
This is a great question, a great science and technology question. Obviously, this person reads the literature, and thanks for asking it. Every laboratory is slightly different. Generally, the range of amplification or cycle times that you talk about is anywhere from between 20 and 35. Every lab can make their own choice about how they do it. Early on, because this is a nucleic acid amplification test, the cycle times are running 40 to 50. That's no longer necessary, because now, because the virus is so present in our community, the cycle times to detect the virus are much lower than, so I think we're in that range. Everyone is different, so I can't tell you which test and who gets what cycle time each one does, but consider it that it's on the lower range, probably 20 to 35.
Thanks, Dr. Urbina. There's a great question in here for Kevin and Margot. Someone simply asked, how can we help?
I would echo Kevin, you did a nice job. You can't underestimate what Kevin said about the support that y'all gave our teams. So yard signs, just thanking them, the chalk art, I know it's cold, but any creative support that you can give healthcare teams, both UCH, nursing home, I know Columbine's doing some hard work as well, and Banner, it goes a long way, you guys. And then the most important is follow Katie's messaging. Get in your bubble, and that's your family, your immediate family. Put your masks on always. Help people if they don't have it on, right? When you feel, if it's comfortable, help people know what wearing a mask right looks like. And be encouraging. I think like Kevin said, we're under a lot of stress, all of us, non-healthcare, etc. Be extra kind, but we can lower this positivity rate if we follow masking, live in your bubble. That means me and my daughter, I don't get to see my sons for Thanksgiving, and your neighborhood is not your bubble anymore. And so just follow Katie's lead on what can you do. That will help our healthcare providers, because if we lower that incidence, they won't get sick either.
Yeah, and I would just add on, the most important things we all can do is masking up, washing our hands frequently, or using the hand sanitizer, socially distance, make sure that we're staying 6 feet apart from each other, and then make sure that we are not involved in gatherings that have the potential to spread the disease. And those are the biggest things. And then you can adopt a a caregiver in your neighborhood and just really prop them up and make them feel special, that would be terrific as well. And I know Thanksgiving is going to look different in the Unger household, and so we've all made hard decisions to not celebrate together. But I think it's going to be prudent that we don't mix different households together, and just be very mindful of who we come into contact with over the holidays.
Thank you. Those are great suggestions. This next question is for Tom. Are there any details on how the changes in the COVID dial will be impacting and or affecting Larimer County in the coming days?
Yes, thank you for that question. A great question when we're looking at the dial. As you may have heard, there's been a change to the dial. There's been an additional level where it's now purple, and the red level is just below. The purple stay at home. There's a red level now that's just below a stay at home. It's some aspects and some businesses are open at a very limited capacity. I think we're at a crossroads right here, and I'm looking at our community and saying, we got to take this extremely serious. I've issued 2 emergent public health orders based upon Dr. Olson's epidemiology from all our contact tracing. We targeted certain areas within businesses and activities, not trying to pin each other's business on each other, but on where we're seeing the spread. We're seeing the spread when people are gathering. So any activity where there's that gathering opportunity is high risk. I'm asking all employers, if you have the ability to have your employees work from home remotely, let's do it. Let's go back to May. Let's do that. I'm asking all our wonderful restaurants, nobody at a bar, no sitting, standing. That's where we see the spread. No waiting room. That was part of the order. There should not be multiple households at a table. You can't do that at your home. We're going to a restaurant and doing that, and we're seeing spread. That's hurting our businesses. At our gyms, we've got to be very careful. We got to wear face coverings. We got to keep things spaced away. Our gyms are doing a great job, and our businesses are doing a great job. Our places of worship, spiritually, we need to make sure we're doing that. It's important for our mental health and our spiritual being, but we got to be very cautious, because when we're singing loudly, that's where it's spread. But if we can't get our numbers to come down, we'll ultimately have to move up in the dial. And those conversations are happening right now, I'm being very honest, that we're way out of compliance within the yellow. Now, we do have a targeted public health order, and the state has been willing to work with us based upon our data and those specific orders. However, our numbers continue to keep going up and doubling, and our hospitalizations keep continuing to go up. And we recently had, unfortunately, 2 more deaths. We have got to curb this. The problem with it is it usually takes 14 days to see any return on investment with any activity. So it's a timing issue, which is, I don't know how much time we have right now, because we're in quite a surge, and it's really going to take all of us to help curb this and flatten this curve.
Thanks, Tom. Here's another question for you. How are you involved with the school district's decisions regarding closing school? What do you have to say about the school board not following the strong recommendations from the governor to have in-person school?
I'd say we've had such a strong partnership with our 3 school districts and our private schools and our charters since before the pandemic, since before March 9th, back in February. They're quite true partners and great school districts and great schools in our community. We're fortunate. What we're seeing is pre-K through 5th grade, very minor to no transmission between student to student and teacher to student or student to teacher. That's being said, that's been very low. That's what the data is showing us. Middle school, 6 to 8, it upticks a little bit harder to cohort, face coverings, and those things. I know I have 2 middle schoolers myself. High schooler, different ball game. We're seeing quite a bit of spread in high schools, and it's just very difficult to make sure we're doing the staggered times, the cohorting and that. It's been very, very difficult on our schools and our teachers. My hearts go out to all our educators. So the pre-K to 5th, all our school districts would love to keep it in person. We've suggested, let's do that. But they don't have teachers. They don't have the staff. Either they're isolated or quarantined, and they can't get substitutes, very similar to what's going on in Kevin and Margot's hospitals. That's what I'm hearing. And they're struggling really hard because they all want to be there with their students. They want to do the in-person learning. They just don't have the faculty and the staff. And that's where they made those decisions. We work daily pretty much, and we looked at the governor's guidelines. We use Dr. Olson's data, and we provide that to the schools. Ultimately, it's their decision. But we want to be working with them and making sure they have the best information to be an informed decision.
Thank you. Next question is for Dr. Urbina. Will nonprofits serving at-risk older adults or populations be part of the public workers phase 1 group? Referring to the vaccine.
It's a great question. I wish I knew the exact answer to this. It looks like those folks that are taking care of special populations like congregate shelters, people with chronic medical conditions will probably fit into the phase 2 category. But I think it depends on the availability of the number of vaccines. Hopefully anybody who is taking care, like a healthcare worker, or home healthcare person who's taking care of a vulnerable population will be prioritized for that first set of vaccines. I'm hoping that it comes. I also hope that it's safe and effective so that we all have access to the vaccine.
Thank you. Next question is for Margot and Kevin again. How many or what proportion of hospitalizations in the county are transfer patients from other counties or states?
Well, I'll start and then Kevin jump in. We're not seeing that many out of state, maybe 1 or 2, maybe 5 a week. 5 would be the max that we've seen in Banner. Some of it is natural though. We have a hospital in Torrington, Wyoming, and they needed a transfer down. It wasn't COVID related. I'll let Kevin talk. I think Scottsbluff has had a little bit more of an impact. But then across counties, I think we both do the same. So Banner's facility is bigger and we take more of the acute ICU and CMC, Makita's as well. But we try to make sure everybody has the right level of care as needed. And so you'll see, if we're full in one place at Banner Fort Collins, we'll move to McKee. If we get full one other place, we'll move to NCMC. So I think that's the gift of being in a big system and having 2 big systems, that we do it both ways. So I think Kevin would share when really UCH gets busy, they'll move over to the Larimer side. So the good news is we balance out the county, is what I'd say, Tom. I think we do so many transfers back and forth, it probably equals out. We only had 1 come in from Denver, and I checked in with the CEO. That was like last week. It's staffing. So as Denver gets busy, we might get a couple from Denver, but not significant. I think the bulk is Well County and Larimer. Kevin?
Yep, and I'd agree with that, Margot. We traditionally within Northern Colorado, we see about 40% of our patient population coming from outside of Greeley, Loveland, and Fort Collins, which is routinely high. Right now, the majority of our patients are within our primary area, which is that Fort Collins, Loveland, and Greeley. We did have to help out and kind of offload some patients at Regional West and Scottsbluff, Nebraska. Several weeks ago, they were up over the 70% rate within their facility were COVID positive. We took some of their non-COVID patients just to help them out. Cheyenne's been fairly self-contained. They have the National Guard that has been called, and they've been able to take care of their patient population in the Laramie. We're not seeing a lot of transfers out. They have a high rate of COVID in that town, but it's mostly within the college-age students, and they're not requiring hospitalization. So the majority of our patients right now are within Weld and Larimer counties as we speak.
Thank you. We have one more question for Kevin and Margot, and then I'm going to turn it back to Tom Gonzalez, to close us out. We do know that there are many, many questions that have come in that we haven't had time to answer. We would like to respond to everyone who has asked a question, and we would ask that you email those to us at covidconcerns@larimer.org. So the last question for Kevin and Margot is, how do you propose to turn the opinions around for those who don't believe in wearing masks or other prevention measures?
This is my favorite question, Kevin. Do you want to go first or should I jump in?
You go ahead.
Well, I say two things. Wearing a mask is not going to hurt anything. And there's evidence that show it actually helps. Not wearing a mask is getting us where we are right now. And so if we don't follow what's on this slide and protect each other, we're in the situation we are because of it. I just firmly believe that in my heart. Do it because you care about each other. And even if you don't even believe the scientific research behind it, which there's articles that I'm happy to send a link to, if you think it's personal responsibility, it's the holiday season, wear it symbolically for our first responders and our care teams. Like, just do it because we care. If you don't believe anything and you're just so angry because people are telling you to wear a mask, it's the holiday season. Wear it for our care teams. You guys, it would mean a world to them. I'm a nurse and I get super protective. It's not going to hurt anybody by putting a mask on. Kevin?
No, Margot really did sum it up. I think it's important that we continue to mask up until this vaccine comes and we all get an opportunity to get the vaccine. It's going to be the only thing that really helps us get from point A to point B, and even that may not be enough. And so the mask is kind of the minimal amount that we each can do to help each other. Once again, the hand washing is important, the social distancing, and just making sure that we're not finding ourselves in gatherings with multi-families. I think that's going to be important. So just please do it. It really does help. If you go into our facilities, everybody's wearing masks, and it's because, as Margot said, it certainly can't hurt. It can only help.
Thank you. I realize I said that I gave you all an email to send us questions, and I just wanted to repeat that for everyone on the line. It is covidconcerns@larimer.org. So covidconcerns@larimer.org. Okay. Katie has asked I do one more question. And so this one's going to be for Dr. Urbina. Why don't we hear more about getting healthy, eating right, losing weight, less drinking, less tobacco, reducing stress, etc., generally improving one's immune system to help fight off sickness?
Thank you for such a positive question. As a family doc for 40 years, I've been preaching this, that we should all eat better, exercise, get plenty of rest, don't smoke, wash your hands. I agree with you totally. If we all did that, we would be a much healthier society. So if you can do that and wash your hands, keep 6 feet away, wear a cloth mask, boy, just think of how much of a better world we would be. We'd all be healthy and we'd be strong enough to fight off any infection that comes in our way. Thank you, and happy Thanksgiving.
Thanks, Dr. Urbina. All right, we'll turn it back over to Tom to close us out.
Yes, thanks, Corey. Thank you, panelists. I appreciate your time and your thoughts and your insights on how we're suppressing the virus. This will be posted on our website. It was recorded and be posted on our website. I'm talking to all our residents of Larimer County. We are truly a magical county, and I mean that. We've done this twice before. We hit the surge. We all went home, and our stay-at-home index, remember that index was well over 0.8. We followed the restrictions. We followed the protocols. We saved lives. We did. We've got to do it again in July. We did it again. Now we have a real steep climb to come down. We've got to curb this tide. We have to stop all gatherings. We've got to get that stay-at-home index to 0.75. That's our North Star right now. That's the call of action. If we can get it up there, we will reduce these cases. We'll reduce illnesses. We'll reduce pain and suffering, and we'll slowly get our beds available in our hospital for all the other issues we have to medically deal with. We have to do this as a community. We have to do this as a society. And it isn't pointing fingers. It's all of us doing it together. We can do this because we've done it before, and it's exhausting, but there is a light at the end of the tunnel now. There's a promising vaccine coming up. I've got a team working on right now how to work with our 52 providers, including UC Health and Banner, Estes Park Health, Salud, named Kaiser Permanente. We're ready to distribute that vaccine. It'll be a 2-dose vaccine, as Dr. Urbina said, but we'll get it. We'll get it out to everybody as soon as we get it. But for now, I'm asking everybody to keep a small bubble. I'm asking people to help us get that stay-at-home index to 0.75, because I believe then these cases will go down, and then we won't have this medical surge in our hospitals. If we can't get that to happen, it will be more tighter restrictions, because we've got to force these gatherings to separate so Kevin and Margot's staff can provide the much needed medical support in our community. Without a hospital bed, that's really going to hurt our economy. So in conclusion, I appreciate Larimer County. We've made so many sacrifices. We're the lights at the tunnel. I'm asking for us to just hunker down here. Let's get that stay-at-home index back up to 0.75 and curb these cases and illnesses and our hospitalizations. With that, thank you everyone, and have a great evening.